Hi everyone, it's Tamara. I'm the Assistant Nurse Manager on Surgical Ortho. The next stop on the pathway is IPOC. So what is an IPOC? IPOC stands for Interdisciplinary Plan of Care. The IPOC is a tool that provides the guidance to establish and maintain a patient-specific plan of care during their admission here at the hospital. It also indicates actions that team members will implement to resolve identified patient problems. Who uses the IPOC? Since the IPOC is an interdisciplinary tool, depending on the reason for admission or patient's needs that may come up, multiple care providers may be contributing. This includes nursing, PTOT, nutrition, respiratory therapy, or care management, and/or social work. What are the expectations for IPOC? An IPOC should be created and initiated for all patients with a set of full admission orders within 24 hours. If there is a patient with the following admission criteria, an IPOC is not required. Observation status, LRP, long recovery period. These are more surgical patients, and outpatient in a bed. This is an example of what an IPOC looks like as a whole. We're going to break it down piece by piece and then pull it all together at the end. These are the symbols that you're going to find on an IPOC. The red and yellow is the target symbol. This reflects an identified goal. The next is the chart symbol. This symbol is related to is for any patient-related education. The last symbol is the gray and red square. This reflects an intervention. So for each discipline, like for nursing, a patient should have no more than 2 or 3 goals. Keep it simple. Don't make it complicated. Don't bite off more than we can chew. All goals should at least have 1 intervention associated. Education should only be added if it's appropriate. IPOCs can be created pretty much 2 ways. Based on documentation that you've already put in when the patient came to the floor, your admission database, your physical assessment, suggested plans are going to be created by Cerner. They will pop up in your orders, and I can show you at the a little bit later where you'll find that. These are IPOC goals that Cerner is recommending based on your documentation that you select for the patient. If based on the suggested plans you don't see a goal that you want to select for this patient, you can type IPOC into orders where you add any other orders, and all of the options will pop up and you can select that. Progression is an important part of an IPOC because we want to know and see how the progress that patient is making towards their goals. This should be done, and all goals should have a target date and time for completion. This should be done when an IPOC is created. During a patient, this can be seen in this corner box all the way in the bottom below. It says target complete date and time. When you select your goal, you'll be able to add the date. So this one says 6/12/2021 and the time 16/21, so that you could set that as your complete date and time. Depending during the hospital stay, team members should be documenting on how the patient is progressing towards meeting their goal. This may pull from your daily documentation, such as patient education or your physical assessment. If not, one should go in and evaluate the status of each goal individually. So if you see here, it says IPOC altered tissue perfusion, that is the goal. So the goal will be to be free from signs and symptoms of DVT and VTE. You can see the green check marks for each shift and identify if it was met or not met. This will actually pull from documentation. The education was related to anti-embolism device, and the interventions were both mechanical and pharmacological prophylaxis. The last screenshot on the bottom is related to diet and nutrition. If you see here, it also has green check marks, and it says 6/11/0400, and it says restate instruction. This pulls from the documentation that nursing already completed surrounding their shift education. Let's go into a patient's chart and create an IPOC and try and put it all together. This is the home screen that we're all used to seeing when you enter a patient's chart. Right now we're on this order tabs. If you go to document and plan, that's where you would see an IPOC if it was done and completed. This patient doesn't have an IPOC, so we're going to go in and create it. Here it says suggested plans. There's 8. So based on documentation such as an admission database or a physical assessment or documentation from other disciplines, Cerner has already created these suggested plans that they recommend that you set as goals. We know that this is a surgical patient, so the risk of a DVT is high. So let's do altered tissue perfusion VTE risk. So you're going to right click here and this will pop up. It says IPOC altered tissue perfusion suggested on, and then we're going to pick a goal. So our goal is that this patient will be free from a sign and symptom of a DVT. Automatically, this is set to occur within 3 days. Glenda, just start back from the suggested plan. So this patient is a surgical patient. So we're going to select altered tissue perfusion related to DVT prevention. Once you click this, you're going to right click, initiate now. This is done for the first goal when you do the IPOC the very first time. So these are the options for our goals. Be free from sign and symptoms of DVT, VTE education, or patient-specific goal. This time we're going to pick be free from sign and symptoms of DVT and VTE. We're going to click that. Automatically, this sets our target to 3 days from now. I think that's reasonable based on the fact that most surgical patients are discharged before that. If this is not, you can extend the duration, or you can make it shorter, or you can start this and change it later. Next, we're going to select anti-embolism device. This patient is wearing SCDs, so we're going to provide education about her SCDs. And then our intervention is going to be mechanical prophylaxis. So now we have a goal, intervention, and an education point. So they all have a target date and time. So we are going to go to orders for signature, and then we're going to sign. Bottom here on the right-hand column. If you go to document and plan, now you will see that this patient has a goal in her IPOC. So let's add one more, but let's do it not from suggested plans. Let's go up here to add, like you would in any other order. Let's type in IPOC. We're going to anticipate that this patient's going to have pain. So pain. So we're going to make our goal her pain score. Again, it sets to within 3 days, which you can adjust if you want. So this says pain score less than 4 on a 0 to 10. Then we're going to identify an education point if necessary. So we're going to add verbal score because we should educate a patient related to pain. However, this says less than 4 and this one says less than 3. So we're going to right click modify, and we're going to change this to a 4 and make it more patient specific. And then lastly, we have to add interventions. So we're going to add assess cause of pain and implement pain management as appropriate. Orders for signature again, and sign. Refresh, document and plan, and you see both here. So now you can see that they have targets, they have goals, they have education, and they have interventions. If you use the plus sign, this allows you to see your target complete date and time, and we can see the outcome description. Now, if the documentation doesn't pull automatically, at some point in your shift, you would want to click here on the goal, bring this up, and you can document met, progressing, or not met, and then explain why the patient hasn't met, or if you want to extend the evaluation date or time. All right, well, thank you.